Good afternoon, and thank you for joining us for today's virtual media briefing about COVID-19 in London and Middlesex County. We're glad to have you along with us. Also happy to be joined this afternoon by the Acting Mayor of the City of London, Josh Morgan, the Chief Medical Officer at London Health Sciences Centre, Dr. Adam Dukelow, and the Medical Officer of Health at the Middlesex-London Health Unit, Dr. Alex Summers. We're happy to have members of the media along, as always, on these virtual media briefings. And just a reminder that if you do have questions that you would like to ask Acting Mayor Morgan, Dr. Dukelow, or Dr. Summers, all you need to do is click on the Q&A icon. That's the text bubble with the question mark inside it here on Microsoft Teams. And when you do, if you could indicate your name as well as your media outlet and who your question is for. And we do have only a few questions in the queue right now, so don't hold back. Don't wait for a hole in the questions. If you want to get those questions asked, make sure you include them as soon as possible. And finally, a welcome to those who are joining us this afternoon on Rogers Television, as well as the Rogers Facebook page and YouTube channel, and viewers on the CTV London website. Let's get to our opening remarks right away, and we'll start this afternoon with Acting Mayor Josh Morgan.
Great, thanks, Dan. So good afternoon, everyone. Today is obviously a significant milestone in our 2-year plus of dealing with COVID. And for the first time since June of 2020, masks or face coverings are optional here in London and across the province. It is clear that masking is a topic that has the potential to be highly divisive and extremely polarizing in our community. Regardless of what you and your family decides, I hope you're understanding and kind towards those who may choose a different course of action than yourself. Ours is a community in which 93.8% of the population has received at least one shot, and more than 50% of the eligible adult population is triple vaxxed. Vaccination is still the single best defense against the virus, and people in London Middlesex have definitely rolled up their sleeves at numbers which far exceed the provincial averages in both second and third shots. That being said, there continues to be a segment of our population which has not completed their full segment of shots, and I end today, again, strongly encouraging Londoners to take advantage of that level of protection that has been offered to you, highly recommended by pretty much every health professional in our province, including our own medical officer of health. And with that, Dan, I'm not sure who you wanted me to throw it to, but maybe you can toss me the right way. Thanks.
All right, thank you, Acting Mayor Morgan. Let's hear now from Dr. Alex Summers.
Thank you, Acting Mayor Morgan. Thank you, Dan. Good afternoon, everyone. I want to start by acknowledging that yesterday marked the first day of spring and also the Persian New Year. This day is celebrated by many in our community and across the globe, and it means new day, Nowruz, marking the official beginning of spring. To all of those who are celebrating, a happy Nowruz to you, your family, your friends, and your loved ones. On the COVID file, the health unit is reporting an additional 54 cases of COVID-19 today and no additional COVID-19 related deaths. Over the weekend, there were 63 new cases and no additional deaths reported on Sunday, and 57 cases and 1 new death, unfortunately, reported on Saturday. That death occurred in a female in her 80s and was in somebody who was not vaccinated. As Acting Mayor Morgan mentioned, the provincial masking mandates have been lifted as of today, with the exceptions of public transit, healthcare settings, long-term care homes, and other congregate settings. Even though that masking requirement is being lifted, the health unit continues to recommend that individuals wear a mask and remain respectful of others, whether they choose to wear a mask themselves or not. Make sure, notably, that you've received the recommended doses of COVID-19 vaccine. For most of us, 12 and older, that's 3 doses. For individuals in highest risk groups, that may be 4 doses. And for kids 5 to 11, that's 2 doses at this time. The vaccine remains the single most important intervention amongst many layers of protection that you and your family can take in order to minimize the risk of COVID to you and your family, as well as to slow transmission through our community. Lastly, it's critical that you stay home if you develop any symptoms of COVID-19 or feel ill. Spring break has now ended, and as many families return to work, school, and to daycare, it's critical that masking remains, notably for those who've traveled, to make sure that we continue to protect those around you from whatever travels we may have had. The vaccine, as mentioned, is so critical, and it remains available in our region at pharmacies, primary care offices as well, and notably mass vaccination clinics as well as mobile sites. Please visit our website or go to covidvaccinelm.ca to check for our latest schedule as well as to book an appointment. You can also book using the telephone 7 days a week for now. Starting next Monday, we will be shifting to a Monday to Friday booking line, but take advantage of those opportunities to get in and get vaccinated. Walk-in appointments are also available. Our mobile clinics continue at community centers, schools, and other locations throughout the region. In April, we'll be moving to a mall in our region to try and make the vaccine available to those that want it and those that are there. The Novavax COVID vaccine is another vaccine that has been approved for use in Canada. It's not yet available in London and Middlesex County. However, we are putting people on the wait list. The vaccine is available only to those who have an allergy to mRNA vaccines or who are looking to receive a non-mRNA vaccine, which is the Moderna and Pfizer, which most of us have received. We do expect a limited supply, but if you are looking to get on the wait list for the Novavax vaccine, you can call the health unit at our booking line at 226-289-3560. Again, that's 226-289-3560 to be added to the wait list. Thanks so much for joining us this afternoon. It is a transition day. Spring is now officially upon us, and with the lifting of the mask mandates, it is going to feel a bit odd when you're out and about. All that being said, the mask continues to be a simple and effective way to reduce transmission for you and those around you. Continue to wear it for now, and we'll continue to provide updates as we continue to monitor the risk of COVID-19 in our community. With that, I'm going to pass things over to Dr. Dukelow from London Health Sciences Centre.
Good afternoon, and thank you, Dan, Dr. Summers, and Acting Mayor Morgan for having me here to share an update on the COVID situation at LHSC. As of this morning, we're caring for 21 COVID-19 positive inpatients, and we have 5 or fewer patients in our critical care. In our children's hospital, there are 5 or fewer inpatients, and therefore, and no patients in pediatric critical care. We currently have 2 units on outbreak. Our partners in infection control, as well as the unit staff, are working diligently to end these outbreaks as soon as possible. As restrictions begin to lift in our province and city, I'd like to take a moment to address the restrictions still in place at LHSC. While we recognize COVID-19 cases are decreasing in our community, our hospital system remains under intense pressure. Our reality is simply different. We can continue to care for a steady stream of COVID-19 patients, and we continue to manage the strain on our health human resources. We also continue to care for non-COVID patients who have reasons to be immunocompromised and more sensitive to the disease should they catch it. Vaccine mandates for both staff and visitors will remain the same. Non-essential care partners will need to show proof of vaccination in order to enter the hospital. Essential care partners will be asked to show proof of vaccine, but will not be prevented entry without it. However, they will be provided with additional safety instructions. Mask requirements for care partners, staff, and patients will remain the same as mandated by the province of Ontario. We thank you in advance for continuing to show support and kindness to our staff and for helping to keep our community safe by continuing to adhere to these policies. Thank you, and I look forward to your questions.
Thank you very much, Dr. Dukelow, Dr. Summers, and Acting Mayor Morgan. Well, we do have a few questions in the queue. Would welcome more, so if you are a member of the media on the call this afternoon and you haven't yet submitted a question, please do so. Just click on the Q&A icon. That's the question mark inside the text bubble here on Microsoft Teams, and when you do, if you could indicate your name as well as your media outlet and who your question is for. Let's go to the questions right away, and we'll start with one from Sawyer Bogdan, who is joining us from Global News Radio 980 CFPL. And Dr. Summers, this is a question for you. Sawyer asks, how much discussion is there right now about recommendations for vaccine boosters going forward? Should we plan to get one every 6 months just to top up immunity?
Great question, Sawyer, and one to which there's still some uncertainty. I anticipate that we will require boosted vaccinations as we move forward for a few reasons. Number one is we are likely to see new COVID variants that emerge that may require modified vaccines in order to gain protection. We have also clearly seen that immunity wanes over time, particularly against symptomatic infection. Given those two variables, the chance that we'll require booster doses moving forward, to me, is high. We operationally at a local level and at a provincial level are planning for the potential of providing booster doses. The timing, though, remains unclear. It will depend on the ongoing studies looking at the risks associated with recurrence of disease or of infection, as well as antibody levels in individuals who've been vaccinated and exactly how quickly they wane. The 6-month mark is often used as a default timeline for boosting, and we'll watch to see exactly how that unfolds. No official news yet, so we'll continue to monitor that. In the meantime, if you haven't got your booster dose yet, that first booster dose, it's time to get it. It's better late than never in so many ways. Thanks, Dan.
Thank you, Dr. Summers. Let's go to a follow-up question from Sawyer Bogdan. This is a question, actually, Sawyer has 2 questions in here, one for Dr. Summers and one for Dr. Morgan. Dr. Morgan, forgive me, Acting Mayor Morgan. We've got so many doctors on the call. All right, here we go. Dr. Summers, what is your reaction to the provincial mask mandate ending? Several councillors are calling for a municipal mandate to be put in place. Are you in support of this? And then for Acting Mayor Morgan, several councillors have asked for an emergency committee meeting to discuss putting a new local mask bylaw in place. Are you in support of a new mandate? And when will the meeting take place? So how about if we start with Dr. Summers?
Certainly. Thank you, Sawyer, for that question. Certainly the provincial masking mandate ending today, I think understandably brings a degree of nervousness to all of us. That mask has been such an important part of our COVID response. The reality is that COVID remains in our community, and masks are an effective way to slow transmission, as we've learned over the last number of years. With regards to a mandate in and of itself, there are considerations around the risks and benefits of a mandate that need to be considered by organizations and decision makers. For us as a health unit, our recommendation continues to be for individuals to consider masking in indoor environments, and for organizations to consider the tools in their toolbox to encourage masking relative to the risk that they appreciate in their setting. And that's the guidance we'll be continuing to provide, acknowledging that there are lots of factors at play here. I'll pass things over to Acting Mayor Morgan.
Yes, thank you. And I will start with the second part of the question first, which is on the councillor's request for a meeting to debate the topic. Just as some background, there are essentially 2 ways that a special meeting can be called. One, it can be called by the chair. With Mayor Holder away, I'm currently in that position of being able to call a special meeting myself. The second way is a majority of council can call a special meeting through a circulation of a request through the clerk to other members of council asking for a special meeting. Given the short timing of this meeting, I essentially did both. I circulated a request through the clerks to my colleagues to see if they were willing and able to meet to discuss this topic at 2:30 tomorrow. And as of 1:57 p.m., I was able to confirm with the clerks that we will be calling that meeting for 2:30 tomorrow. That agenda is now posted on london.ca. It is a 1-item meeting to deal with the debate around the requests that the councillors have put forward. And so there is a majority of council who are willing to have a discussion on this topic. And so in any good democratic society, that discussion will proceed. And as Dr. Summers said, there are a number of considerations that I anticipate will be debated around that topic. You asked about my thoughts on the councillor's motion. And again, I will preface this with, I think each and every councillor will have their own individual thoughts on this. We all get one vote around the council table. And so my thoughts certainly don't presume or guide exactly how the debate will go. But I have said on previous iterations of this media call that I do not believe that councillors are public health experts. And I'm not convinced that we should be moving into setting public health policy. When we first passed that mask bylaw back in the summer of 2020, we didn't do that in isolation. It was a move that was made on the strong urging and unequivocal recommendation of the then medical officer of health. And as Dr. Summers has said today, he is not in a position to make a strong, specific recommendation for council to have a mandate, because there are other considerations that council may want to consider in moving forward with that. So without a firm recommendation from the chief medical officer of health in our region, I would have significant concerns going down that path myself. I also have some questions about the negative impacts on local businesses who have gone through a very difficult time. If municipal council would move in this direction, unlike when the province moves with restrictions, the province has provided financial support to those businesses, and municipal council may not be in a position to support those who are negatively impacted by the institution of restrictions at the municipal level. So I have a number of questions around our capacity to move forward from that perspective. And so I think overall, I certainly have some concerns, as you've heard today, and I do have certainly a number of questions about the impacts of the motions. But I will say, like every debate, I am interested in hearing from my colleagues, and I expect that we will have a constructive debate on the matter tomorrow.
Thank you very much, Acting Mayor Morgan and Dr. Summers. Let's go to our next question, and it is from Jerry Dewan at CTV. And Jerry, I'm reading your question, and I think that Acting Mayor Morgan may have just answered that. Please let me know if that was not the case. But Jerry was asking for the Acting Mayor to share his thoughts about continuing to have the debate about masking, and I think we've addressed that. So, Jerry, if you have another question, by all means, I'll watch for it.
Dan, I may have preempted a bunch of the questions that I see in the queue now with my comments just now. So my apologies for that, for getting ahead of everyone, but I figured it was something that you would want to know about anyways.
And I'm absolutely, and I'm just I'm getting caught up here, and I think that I'm looking Christy Lee Varley from CTV. Is there an update on what will happen with the city bylaw as it relates to masking? I think that Acting Mayor Morgan has spoken to that as well. And the last question that we had in the queue right now is from Megan Stacey at the London Free Press. And I think we've answered that one as well, Megan. So there we go. That question was about, does Acting Mayor Morgan support a municipal masking bylaw, and would a municipal bylaw related to indoor masking also apply to schools? That conversation hasn't yet happened, so the details would not be available at this time. All right, there is one more question that just came in from Sawyer Bogdan, and Dr. Summers, this one is for you. Dr. Summers, previously Dr. Mackey had urged that the mandate be put in place. Based on your last answer, is the health unit not taking a strong stance on it this time?
Thanks for that question and clarification, Sawyer. Certainly, we are in a different context here in 2022 in light of the duration that we have been through this pandemic, as well as the high vaccination status we have, particularly amongst those most vulnerable for hospitalization. As I've stated, the use of masks remains strongly recommended by me for individuals and organizations to consider in indoor environments, and organizations should consider the tools in their toolbox in order to increase masking, recognizing the risk in their settings, as well as the risks and benefits that a mandate might bring. I can't speak to whether or not a mandate is the best course of action. That truly is something for council to consider.
Thank you very much, Dr. Summers. And we did get a question back from Megan Stacey. And this is for Acting Mayor Morgan, and it does relate to the discussion about the proposed bylaw discussion that is on the City of London's website now. Megan asks, would a municipal bylaw related to indoor masking also apply to schools in London?
Yeah, so the short answer to that question is I don't know. With any bylaw, we will certainly have our legal staff there who will be able to answer questions regarding the bylaw on its applicability and its enforceability in different circumstances and situations. So that would certainly be a question that I would anticipate we could answer during the debate, but not something that I'm able to clarify at this time, given I've not reviewed a draft bylaw yet, nor have I sought any sort of advice from our staff on how widely it could be applied.
Thank you very much, Acting Mayor Morgan. And that does bring us to the end of the questions for today's virtual media briefing. Thank you to the members of the media who attended and for sharing your questions. And to our panel, as always, thank you to Acting Mayor Josh Morgan, Dr. Adam Dukelow, and Dr. Alex Summers. Thank you for your insights. Thank you for your information, as well as we continue to navigate the challenges of the COVID-19 pandemic in London and Middlesex County. That will do it for today. And this is the first week where we have moved to our once weekly virtual media briefings. So there will be no media briefing on Thursday this week. As previously announced, we are moving to Mondays only. So we will see you next Monday afternoon at 2 p.m. We hope you'll be able to join us. Have a great rest of the week, and so long for now.